Hi everyone, this presentation is for evaluation and management coding guidelines. Here in this presentation, we can see how we are taking the level for each CPT code and how we are predicting that level. So we are moving on to the presentation, and purely evaluation and management code depends upon three categories, and it is history, physical examination and MDM. So the next one is history. History includes all the HPA elements, review of systems, and patient's past family, social, and family history, whichever patient tells about during the examination. So these all the categories will make depends upon the patient's health condition, and it will show the it will help us to get the level. And the physical examination is where the provider examine the patient and documents in the medical record. So based on the documentation, we can able to get the level. And here comes the main category of E&M level. This is the MDM, where we say is medical decision making. Here this also having some categories, and this have three type of categories which needs to be documented in the assessment and plan. So the one is the first point is the number and complexity of problems that are addressed during the encounter, the amount and or complexity of data to be reviewed and analyzed. Third one is risk of complications and or morbidity or mortality of patient management. So in the coming slide, we can see how it is categorized and based on what condition it is categorized into low level or higher level of codes. So this comes the number of complexity. So it is like if the patient medical record has one self-limited or minor problem, the it is considered as a minimal complexity. And if the patient is having two or more self-limited or minor problems, or one stable chronic illness or one acute uncomplicated illness, it is considered as a low level of complexity. And another if it needs to be moderate, then the patient should have one or more chronic illness with exacerbation, progression or side effects of treatment, or two or more stable chronic illness, or one undiagnosed new problem with uncertain prognosis, or one acute illness with systemic symptoms, or one acute complicated injury. And if the document needs to be mentioned as a high complexity, then the patient should have one of the following, that is one or more chronic illness with severe exacerbation, progression or treatment side effects, or one acute or chronic illness or injuries that may pose a threat to life or a bodily function. And And the next one is the amount and or complexity of data to be reviewed and analyzed. When the physician analyzes or reviews the patient's previous health condition, and if he orders a new lab report, or each unique test is ordered for each particular visit, that can be considered as a data points. And based on the things that has been done on that particular visit, it has been categorized, and based on that we can also make the complexity of that report as a low, moderate and extensive. So whenever the physician does like any combination of two of the following, any two of these can has been done, like review of prior external note from unique source, or review of results of each unique test, ordering of each unique test. If any two has been done on that particular day, it has been considered as a low level of complexity. And next one is like if it is moderate, that has been categorized by a combination of three from the following, like prior external source review and review of each results of each unique test, ordering of each unique test, assessment requiring an independent historian. If any three of these has been documented, it can be considered as a moderate complexity. And the next one, or this has to be documented, or independent interpretation of test, independent performed, these are the tests performed by another physician or other healthcare professional, it has not been separately reported. And or it has been considered as moderate discussion of management or test interpretation with external physician or other qualified healthcare professional or appropriate source. So if the test result has been discussed with the other physician, that can be considered as a moderate level. And if it is extensive, it means that uh, categories or these are the same, and any three of these following has to be reported, or the same thing, it means that must meet requirements of at least two from all the categories has to be documented. So if it is documented, then we can consider as a extensive. And the next one is risk of complications and or morbidity or mortality of the patient management. So, based on the patient's health condition and based on any prescriptions provided, or if any drug therapy or some, if any surgical treatment is recommended, so based on the patient's medical record, it has been categorized into the low, moderate, and high category. So, prescription drug management, if the physician provides a prescription and decision regarding minor surgery has been discussed, and decision regarding elective major surgery without identified patient or procedure risk factors, diagnosis or treatment significantly limited by social determinants of health. So, if the medical record supports for this type of category, then we can consider as a moderate. And when it is high means the document should meet drug therapy requiring intensive moderate monitoring for toxicity, decision regarding elective major surgery with identified patient or procedure risk factors, decision regarding emergency major surgery, decision regarding hospitalization, decision not to resuscitate to or to de-escalate care because of the poor prognosis. Uh, these are the categories of the MGM based medical documentation. In simple way, how we can give to the provider is like, if the patient has a two or three diagnosis conditions, and the physician recommends for a radiology, for x-ray or something like that on the particular day, and also prescription of some drugs, and if documents like if any case of emergency that needs to be follow up, like the document is given, then at that point we can consider as a moderate level. If it is a new patient, we can go for 99203, and if it is a established patients, we can go for a 9920214. And in sometimes provider may spend most of the time with the patient, but the time has been spent on the counseling with the patient or explaining some conditions to the patient, but the time the medical reports does not support for billing the higher level of codes. It means that 214 or 204 or 203 or something like that. So at that time, what we can check in the medical documentation is like time-based medical documentation. Time-based documentation, in the way we can mention it in the two ways. One way is like start and end time of the patient. when the patient comes into the doctor's review, at that time it starts when the provider starts examining the patient. At the time starts that time. So once he finishes the examination and signs of the report, that time is considered as the end time of the report. So that time has been calculated. That is the one thing. And another thing is like the provider can mention the total time spent with the patient. So the two ways are there to mention the time in the documentation. One is start and end time, and another one is the total time spent with the patient. And also, if we are going for the time based documentation, at that time what physician need to do is like needs to mention that in that for example, if the provider mentions as total time spent 45 minutes, and also needs to provide the document below as in that majority of the time or more than 50 percentage of the time. We can use either words. Either we can use if the in that majority of the time was spent in counseling the patient, in the way we can describe, or else in that more than 50 percentage of the time were spent in counseling and coordination of the patient. So the in that way we can go with the time based documentation. So I will explain about the each CPT code with with their requirement and the time based documentation. So this is the time can be considered for each particular CPT. For 99202, we can if the document supports for if the patient is a new and if the provider mentions 25 minutes, we can go for the level 202. And for 203, if the provider mentions the total time spent with the patient as 42 minutes or 43 minutes, till 44 minutes we can go with the level 203. In the same way for 204, 45 to 59 minutes. For 205, it is 60 to 74 minutes. So if we want to bill for the higher level, then we need to mention the time spent with the patient. And in the similar way, it is for established patients 212, 213, 214 and 215. So based on the time spent, we can go for the levels. And actually in the till 2020 we were considering all the history and physical examination and along with the MDM part. As 2021 guidelines has been updated, we are mainly looking for the MDM level of category. So it is purely based on how many diagnosis has been documented and how much the doctor has been reviewed the medical records, what are the data has been reviewed and what has been prescribed and what are the things that needs to be follow up and something like that. These are the main categories based on the medical record. Also along with it, history and physical examination should be minimally documented. That is enough. The main thing is we need to concentrate more on the MDM part. So if we are not able to get that much of time, and if the provider spends much time with the patient, then we can go with the time based documentation. In that way we can build the higher level of codes. So this is what here I have explained. New guidelines has been followed. There should be minimal documentation for history and physical examination, and the level of the code purely depends on the MDM part. So if we need to go for the higher level, either we need to document the MDM part stronger, or else if we can go with the time based documentation. So this is all about the E&M coding guidelines. Please let me know if you have any questions. I'll try to explain it much clear. Thank you everyone.